Hello, this is Dr. Eric Bricker, Chief Medical Officer at First Stop Health, and today I want to speak with you about the difference between virtual primary care and traditional in-person primary care. So obviously, the first difference is that virtual primary care occurs over video or a telephonic visit, whereas traditional primary care typically happens in person. Okay, so virtual is very obviously different than in-person primary care in that respect. Okay, difference number two. Obviously, if you are on video or phone, you don't have to travel to the office. So, as many of you probably already know, up to a third of people on a health insurance plan have a primary care doctor, and 2/3 do not. They don't go. And so this way, people can have access to a primary care doctor without having to actually go, because it's so inconvenient, it takes so much time, especially for folks that are paid hourly, like they have to miss work and they have to miss income in order to see the doctor. So this is a much more convenient way to still receive care. Employers can put in virtual primary care at zero out-of-pocket cost for their employees without changing their other benefits. Now, next point is that virtual primary care doctors are independent from a hospital system. Unfortunately, many physician practices are owned by hospital systems now. And unfortunately, oftentimes, that relationship between the primary care practice and the hospital either specifically requires or highly encourages steerage to just that hospital for testing and procedure or specialists. And you don't necessarily want that. You want your employees getting the best care from the best specialist available to them. It may or may not be at one particular hospital system, but you want your primary care doctors to be independent so that they have the freedom to refer to whoever they want. Okay, next up. 24/7 access is available with virtual primary care, whereas with often traditional practices, that's not the case, because the virtual primary care group acts like a group practice supporting employees and their families. So your chosen primary care physician might not be available at 11 p.m. on a Sunday night, but we have a whole team of physicians that are available for those urgent care visits. Okay, now finally, virtual primary care allows better access to specialists. Let me tell you why. One, within your existing PPO plan design, people can just self-refer to specialists. The problem is that there's over 50 different types of specialists. There are cardiologists. Within cardiologists, there are electrophysiologists and interventional cardiologists. Now, you have orthopedic surgeons. Within orthopedic surgery, you have hand specialists and spine specialists and knee and hip specialists. Now, within OBGYN, you have maternal fetal medicine specialists, you have reproductive endocrinology specialists, you have gynecologic oncology specialists. So, the point is, there's gobs and gobs of specialists. It's super hard to figure out which specialist is the right one for your particular issue. But that is part and parcel to what primary care physicians do, is to connect people into the specialist that is best going to treat their condition if the primary care physician is not able to, because it's outside of their scope, which is totally okay. Now, with a traditional practice of having, you have to go in and you have to wait in a waiting room, you got to wait in the exam room, you've got to have, that care coordination with a traditional primary care practice is typically not reimbursed by the insurance company. So the problem is that if it's not paid for by the insurance company, then oftentimes the traditional primary care practice doesn't necessarily do all the coordinating function that they probably should. But the point is that when you have a direct contractual relationship with a virtual primary care practice and an employer, then it gets rid of that perverse fee-for-service reimbursement that only pays for the visits. You want to pay for the care coordination in addition to the visits, which is why having a direct relationship with a primary care practice that's virtual is superior to a traditional fee-for-service insurance-based primary care practice. So that's a lot of information, but I wanted to go over why virtual primary care is different than traditional primary care. Thank you for watching.